Fragile X syndrome, also called Martin-Bell syndrome, Marker X syndrome, and Fraxa syndrome. That's spelled Fraxa. It is an inherited genetic mutation and is the most common form of an inherited intellectual disability, as well as the most frequent cause of autism spectrum disorder. A mutation in the FMR1 gene is the cause of Fragile X syndrome. A normal FMR1 gene provides instructions for making a protein called FMRP. This protein regulates production of other proteins and plays a role in the development of synapses, which are what transmit nerve impulses. In Fragile X syndrome, a mutation in a segment of DNA called CGG triplet repeat is expanded. Normal CGG triplet segment is normally repeated 5 to 40 times. In Fragile X syndrome, it is repeated over 200 times. This silences the FMR1 gene and prevents production of FMRP. Some people have a premutation, it's called, and they have a repeat of the CGG segment of only 55 to 200. Most of these people are considered normal, but may have mild physical and intellectual symptoms. Fragile X syndrome is passed on in a X-linked dominant pattern. A male with the disease has 0 chance of passing it along to his sons, but he does have a 100% chance of passing it on to his daughters. Females have a 50% chance of passing it along to their children. Because this is an X-linked mutation, males with only one X always have the full mutation and have signs and symptoms of Fragile X syndrome. Because females have 2 X's, the normal X is normally able to produce enough FMRP that they have less severe signs of the syndrome or none at all. My research showed that nobody really agrees on exactly how many people have it. I found multiple different numbers, but they all agree that males are almost twice as likely to have it than females. The Fragile X Foundation states that 1 in 4,000 males and 1 in 6,000 females. The National Institute of Health agrees with the Fragile X Foundation in the 1 in 4,000 males, but states only 1 in 8,000 females have it. And the Centers for Disease Control state that 1.4 males per 10,000 have it and 0.9 females per 10,000 have it. So I'll let you decide on which number you think is most reliable. Physical features seen in Fragile X syndrome include large ears, long face, soft skin, flat feet, high arched palate, hand flapping, double jointed fingers, prominent jaw and forehead, and macroorchidism, which are large testicles. They tend to have delayed speech development by 2 years of age, and they have behavioral disorders that include attention deficit disorder, attention deficit hyperactivity disorder, autism, social anxiety, increased aggression, hand biting, and poor eye contact. They are also prone to ear infection and having seizures. The slide states about 10%, but I found a number stating 25% have a seizure disorders. As the picture shows, most of the physical features do not become prominent until after puberty. There are no specific physical or behavioral traits in Fragile X syndrome. Some people with it may show several of the traits, and some may have very few. Only a genetic test can confirm if a person has Fragile X syndrome.
Females are less affected than males are with Fragile X syndrome, but it is thought that females have more social delays than males do with Fragile X syndrome, and where males have more coordination and short-term memory problems with Fragile X syndrome.
There are 2 conditions associated with carriers of the FMR1 gene pre-mutation. That's when they have their CGG repeat 55 to 200 times. The first one primarily affects females, and that is POI, primary ovarian insufficiency. This is when they stop having their periods before age 40. 21% of pre-mutation carriers will have that one. The other one is FXTAS, which stands for Fragile X Associated Tremor Ataxia Syndrome. It affects men primarily over the age of 50, even though women can have symptoms. They are usually much less severe than what males have. They usually have trouble with their balance. They end up with the shakes in the body, mood changes, and memory problems. Children showing development delay, diagnosis of autism, or showing mental disability should have genetic testing for Fragile X syndromes. Also, any individuals seeking reproductive counseling who have a history of Fragile X, autism, or mental disability in their family history. And those experience late onset tremors and cerebellar ataxia of unknown origin. All of these people should seek genetic counseling to determine the cause.
When diagnosing Fragile X syndrome, really the only way to diagnose it is through genetic testing with a genetic counselor. But oftentimes there's unnecessary testing done prior to the diagnosis due to the fact that pediatricians aren't necessarily looking for Fragile X syndrome. They're looking for maybe some other neurological issue. So these tests include lumbar punctures, MRIs, CT scans, and things like that, where genetic testing is really the only way to determine if a child has Fragile X syndrome. And it's very important that families get genetic counseling during that genetic testing. The genetic counselor is a great resource for the family. They help review the genetic testing and diagnosis, help make referrals as needed, and help identify carriers within the family as well. The Fragile X syndrome is often underdiagnosed or has a lag in diagnosis. A study was done in 2018 and published in the Journal of Pediatrics that showed males often start showing signs at 12 months of age, but on average are not diagnosed until 4 years of age, where females start showing signs and symptoms around 23 months of age and are not diagnosed until about 9 years of age. It was thought that most of the time this was due to the physical dysmorphia that may or may not be present or very prominent in the child. So some of these physical dysmorphias are enlarged ears, elongated face, the high arch palate. So treatment for Fragile X syndrome is really dependent on the child and the different issues that come along with it. Since it's not a progressive condition and there's no specific medical concerns, there's not one treatment fits all. So some of these medications might include medication for ear infections, seizure disorders, or medication for behavioral disorders as well. Therapies is probably one of the biggest treatments for Fragile X syndrome and should be initiated as soon as possible. So these therapies include physical, cognitive, speech, behavior, occupational, and psychological therapy. I would also include family counseling in that therapy because having a child with a genetic disorder is very trying on the family as well. There are several different roles that a nurse plays in caring for a child with Fragile X syndrome, and even caring for the family with a child with Fragile X syndrome. I think one of the biggest roles is a support person for the family, especially during that lag of diagnosis. That is such a trying time for the family, not knowing what their child's diagnosis is, and really needing that consistent person and sounding board for the family is important. Also, the role of an educator. oftentimes families are learning about things that they may never have heard of before. And it's important to, as a nurse, to empower the families and educate them so they can make educated decisions for their child. So educating on what is genetic testing, what is genetic counseling, what are the several different therapies that are possible for their child. Also going along with those therapies is a coordinator, helping make those referrals and helping coordinate those different therapies for the family is also an important role of the nurse.